So, should you actually be eating eggs after 60? Or is avoiding them quietly working against your body? Because this is where a lot of people are still operating on outdated advice. Some still limit eggs because of cholesterol. Others eat them every day and say they feel stronger, more stable, even mentally clearer. And both sides sound reasonable. But here's what most people do not realize. Your body, after 60, responds to food differently than it did years ago. The body does not just age, it adapts. The same foods, the same habits, the same routines start producing different results over time. And eggs are one of the foods where that difference is most measurable. In the next 24 minutes, I'm going to walk you through exactly what eating 4 eggs after 60 does to your muscle maintenance, to your cognitive function, and to your vision. The cholesterol question, properly answered with what the current research actually shows. The 4 mistakes that completely cancel the benefit, even if you are eating eggs every day. And the specific structure, how many, prepared how, paired with what, that makes the difference between eggs working and eggs doing nothing. I'm Dr. Karen Holm, your Senior Vision Wellness Educator. The information in this video is grounded in published research from the American Academy of Ophthalmology, the National Eye Institute, Mayo Clinic, and Harvard Health on egg nutrition and aging. If you want clear, practical health insights like this, take a moment to hit the like button and subscribe. It is the one thing that decides whether this video reaches the next person who needs it. And before we go further, type in the comments how many eggs you are currently eating in a typical week. Just the number. The pattern across this audience genuinely shapes what I cover next. Before I go further, I want to draw a clear line. There are vision and health symptoms that mean stop watching this and call your doctor today. Sudden vision loss in one eye over hours or a single day, that is an emergency. Severe sudden chest pain or pressure, especially if it radiates to the jaw or left arm, that is an emergency. New severe leg swelling with calf tenderness, that can be a clot. Same-day medical attention. If any of those describe you, stop this video and call your doctor today. Eggs are not the answer to those situations. If your concern is gradual, losing strength a little each year, noticing memory recall is slower than it used to be, vision sharpness softening over months, then stay with me. That is exactly the pattern this video is for. Now, here is where this starts to matter. After 60, one of the most important changes is something most people never notice directly. Muscle response begins to decline. Not just muscle size, the ability to respond to protein. This is well documented in aging research as anabolic resistance, meaning your muscles require a stronger signal to maintain themselves and rebuild. The same amount of protein you used to eat no longer produces the same effect, and that shifts everything in your body's response to the food you eat. Because maintaining muscle is not just about strength, it directly affects balance, mobility, and long-term independence. And this is where eggs become relevant in a very specific way. Eggs have one of the highest biological values among whole foods, meaning a larger portion of the protein you consume is actually converted into usable body tissue. So, it is not just about eating protein, it is about how efficiently your body can use it. And this is where many people unknowingly go in the wrong direction. They increase protein intake but not protein quality. When results do not change, it feels like nothing is working. Now this is where it shifts again. Eggs are not just protein, they carry something else your body increasingly depends on. Think about this for a moment. Have you noticed small changes in memory or focus? Not dramatic, just slower recall, slightly more effort to concentrate. Because this is where another change begins to show up. Choline. Eggs are one of the richest dietary sources of choline, and choline is required to produce acetylcholine, a neurotransmitter essential for memory and cognitive function. Many adults do not consistently reach the recommended choline intake levels. This becomes more relevant with age. So, when people increase egg intake and notice clearer thinking, it is not coincidence. There is a physiological reason behind it. Now here is another layer that becomes harder to ignore. Vision. After 60, the retina becomes more vulnerable to cumulative stress over time, age-related macular changes, gradual loss of visual sharpness, slower adaptation to low light. This is where eggs provide something very specific. Egg yolks contain lutein and zeaxanthin, carotenoids that are concentrated in the macula, the central part of your retina responsible for sharp central vision. Research links higher dietary intake of these compounds with a lower risk of age-related macular degeneration and better visual function over time. Here is the part most patients have never been told. Egg yolks deliver lutein and zeaxanthin in a form that is more bioavailable than spinach. Spinach contains more total lutein per gram, but the carotenoids in spinach are trapped inside a tougher plant cell structure that limits absorption. In egg yolks, the lutein is already bound to dietary fat, which is exactly what the body needs to absorb it. Multiple studies have measured higher serum lutein response per gram from egg yolks than from leafy greens, even though the leafy greens contain more of the raw nutrient. One egg yolk, properly cooked, can deliver more usable macular pigment than a full cup of raw spinach. So, now a pattern starts to form. Muscle response declines, cognitive signaling slows. Visual protection becomes more important, and eggs support all three at the same time. This is usually where the primary concern for most people comes in, cholesterol. Because eggs contain cholesterol, and for years that was the main reason people were told to limit them. But this is where understanding has shifted. For most individuals, dietary cholesterol has a relatively modest effect on blood cholesterol levels compared to overall dietary patterns and metabolic health. In many cases, egg consumption is associated with increases in HDL, the lipoprotein often linked with protective effects. What matters more is the context. Eggs eaten within minimally processed diet behave very differently than eggs combined with highly processed foods. The outcome is not just about eggs, it is about the environment they are part of. Now there is another piece that becomes more important over time: nutrient delivery. Eggs provide fat-soluble vitamins, A, D, E, and K, in forms that are readily absorbed and used by the body. After 60, nutrient absorption and utilization can become less efficient, so foods that deliver nutrients in a bioavailable form become more valuable, not because you need more food, but because your body needs more usable nutrition. So when you step back and look at this clearly, this is not about labeling eggs as good or bad. It is about understanding what your body is gradually losing over time and whether what you are eating replaces that loss. That is the real shift after 60, not general nutrition but targeted support. Let me tell you about Helen. Composite patient, illustrative, but the pattern matches what we routinely see when older adults restructure their egg intake. Helen is 69. For about 2 decades she had been told to limit eggs because of borderline cholesterol numbers. She had moved to a low-fat, high-grain breakfast routine. Oatmeal, whole grain toast, fruit, sometimes egg whites without yolks if she wanted protein. Her blood work was stable, her doctor told her she was doing everything right, but Helen had been quietly losing function. Climbing the stairs at her grandson's third-floor apartment had become harder. Reading the New York Times print edition required reading glasses. Reading glasses she had not needed at 65. She woke up tired most days, even when she slept 8 hours. Helen's diet was technically balanced, but missing 2 things her body now needed more of: high biological value protein and bioavailable fat-soluble nutrients. Egg whites had given her protein, but stripped out exactly what makes eggs uniquely useful after 60. When Helen restructured to 2 whole eggs daily with the yolk, prepared by soft boiling or poaching, paired with a small serving of sautéed greens or whole food vegetables. Within 4 weeks she reported feeling steadier on the stairs. By 8 weeks her morning reading distance had improved enough that she could go without the new reading glasses. By 3 months her blood work still looked stable and she had quietly regained function she had assumed was permanently gone. Helen did not eliminate her other healthy patterns. She kept the whole grains, the vegetables, the fruit. She added back what had been missing. Now this is where most people want a clear answer. How many eggs should you actually be eating after 60? Because this is where things often go in the wrong direction. Some people avoid eggs completely, others eat them randomly without any structure. Neither approach is giving you the full benefit. What current research and clinical patterns suggest is that for most healthy adults, moderate egg consumption fits within a balanced dietary pattern without increasing cardiovascular risk. Large observational studies have consistently shown that around 1 to 2 eggs per day is not associated with increased heart disease risk in generally healthy populations. But here is where the conversation shifts after 60. The goal is no longer just avoiding risk, it becomes maintaining function. That includes muscle, cognition, vision, and metabolic stability, and this is where the amount starts to matter differently. Because of anabolic resistance, older adults often require a stronger protein signal to stimulate muscle protein synthesis. In practical terms, that usually means aiming for roughly 25 to 35 g of high-quality protein within a meal. One egg alone is rarely enough to create a meaningful response. This is where many people unknowingly fall short. They treat eggs as a small addition rather than a functional component of the meal. The question changes. It is not just whether you eat eggs, but whether you are eating enough to create an effect. For many people, that ends up being around 2 to 3 whole eggs in a meal. For some, closer to 3 to 4 depending on their overall daily protein intake. That is not a strict rule, it is a functional range based on how the body responds. What matters is the total protein quality and whether it reaches the threshold needed to stimulate muscle maintenance. Quick interruption. If this is making sense so far, hit the like button. It is the single thing that decides whether this video reaches the next person who needs it. Someone who has been quietly limiting their eggs for years because of cholesterol advice from a decade they have already left. Now, here is where the benefit often gets quietly canceled out. It is not the egg itself, it is what comes with it. Mistake number 1, eggs paired with processed meats, refined bread, or sugary drinks. In that context, the metabolic response shifts. Refined carbohydrates can lead to rapid glucose increases. Regularly consuming processed meats has been associated with higher cardiovascular risk. So, the body is no longer responding to the egg alone, it is responding to the entire pattern, and that changes the outcome. This is where many people misinterpret what is happening. They assume eggs are the issue, when in reality, it is the surrounding foods. When eggs are paired with fiber-rich vegetables, whole food carbohydrates, or unsaturated fats, the metabolic response becomes much more stable. Blood sugar rises more gradually, satiety improves, the overall nutritional profile supports what the body needs after 60. Mistake number 2. Removing the yolk. This is often done to avoid cholesterol or fat, but it changes the nutritional value significantly. The majority of the key nutrients in eggs, including choline, lutein, zeaxanthin, and fat-soluble vitamins, are concentrated in the yolk. When you remove the yolk, you are left primarily with protein but without the components that support brain function, eye health, and nutrient absorption. Egg whites can still be useful when additional protein is needed, but relying on them alone removes much of what makes eggs uniquely beneficial after 60. If you are skipping the yolk specifically for vision-relevant nutrients, you are getting protein and almost none of the macular protection that made the egg worth eating. Mistake number 3. Cooking method. High heat over longer periods can reduce certain sensitive compounds, particularly carotenoids like lutein and zeaxanthin. That does not mean cooked eggs are a problem. But it does mean preparation matters. Methods like poaching, soft boiling, or lightly scrambling at lower heat tend to preserve more of these nutrients. It is not about perfection. It is about understanding that small differences in preparation influence what your body actually receives over time. The same egg cooked too hard for too long delivers measurably less of its carotenoid value than the same egg poached. Mistake number 4. Timing not aligned with the body's protein responsiveness. While many people associate eggs with breakfast, what matters more is when your body is most responsive to protein intake. After longer periods without food, such as overnight, the body tends to respond more strongly to protein. That is one reason eggs are commonly used in the first meal of the day, but they can be just as effective later, especially if earlier meals were low in protein. So again, it is not about tradition, it is about function. Now this is the part most people are still unsure about, even after everything we have covered. Cholesterol. Because no matter how much new information comes out, this concern does not fully go away. and that hesitation is understandable. For years, eggs were directly linked to rising cholesterol and heart disease risk. So even now, many people limit them, not because of what they feel, but because of what they have been told. When you eat cholesterol from foods like eggs, your body does not simply add that amount directly into your bloodstream. The body regulates cholesterol through a balance of production and absorption. In many individuals, when dietary cholesterol increases, the body compensates by reducing its own production. This regulatory process has been demonstrated in multiple metabolic studies and helps explain why the response to dietary cholesterol varies from person to person. In most healthy individuals, moderate egg consumption has a relatively small impact on LDL cholesterol compared to other dietary factors, refined carbohydrates, trans fats, and overall dietary patterns. Some studies have also shown that egg consumption can increase HDL levels, which are involved in reverse cholesterol transport, a process that helps move cholesterol away from the arteries and back to the liver. But here it is important not to oversimplify. Not everyone responds the same way. Some individuals, often referred to as hyper-responders, may experience a larger LDL increase. Even in those cases, HDL often rises as well, and the balance between these markers becomes more important than a single number alone. This becomes even more relevant after 60 because the body's response to food becomes more dependent on the overall metabolic environment. The effect of eggs is influenced more by what surrounds them than by the egg itself. Another factor that needs to be considered is inflammation. Cardiovascular risk is not determined by cholesterol alone. Chronic low-grade inflammation plays a central role. Development of plaque within the arteries. Eggs, when consumed as part of a balanced diet, do not appear to increase inflammatory markers in most individuals. However, when combined with highly processed foods and poor metabolic control, the overall inflammatory environment can shift. So again, the pattern matters more than the individual food. Who should be more cautious with egg intake? Individuals with certain conditions. Poorly controlled diabetes, specific lipid disorders, familial hypercholesterolemia may require a more individualized approach. This way, a personalized conversation with your physician matters in those cases rather than a general restriction applied to everyone. And here is where a different type of mistake happens. People reduce or eliminate eggs out of caution, but they do not replace the nutrients eggs were providing. Protein intake decreases, choline intake becomes less consistent, lutein and zeaxanthin intake drops, fat-soluble vitamin intake is reduced. Over time, those changes do not always show up immediately in lab results, but they can absolutely affect how the body functions day to day. After 60, the goal is not just to manage numbers. It is to maintain function, strength, stability, cognitive clarity, visual performance. So, at this point, the question becomes much more practical. If eggs can support muscle, brain, and eye function after 60, what is the best way to actually use them so you feel the difference? First, structure the meal around them. Eggs work best when they are not isolated. Combined with fiber-rich vegetables or whole food carbohydrates, the body's response becomes more stable. Blood sugar rises more gradually. Insulin response stays more controlled. Satiety improves. A simple example: eggs with sautéed vegetables, leafy greens, or legumes, rather than eggs with refined bread or sugary drinks. Second, consistency. After 60, the body responds more to patterns than to single meals. Eating eggs occasionally will not produce the same effect as incorporating them regularly into a balanced routine. The body adapts to repeated signals. Third, preparation. Poaching, soft boiling, or gentle low-heat scrambling preserves more of the heat-sensitive nutrients. At the same time, cooking improves protein digestibility. The goal is balance, not perfection. Fourth, total daily protein. Eggs can be a strong foundation, but they may not cover the full requirement on their own. Combining eggs with other protein sources helps ensure overall intake. Combining eggs with other protein sources, fish, legumes, dairy, helps ensure overall intake supports muscle maintenance. Fifth, timing flexibility. Eggs do not have to be a breakfast food. They are most effective when used to anchor any meal where protein quality matters. After a long fasting period overnight, the body tends to respond more strongly. The low-protein earlier meal can also benefit from eggs later in the day. So again, it is not about tradition, it is about function. Hydration and overall dietary balance also influence how well any of this works. Even high-quality foods do not function in isolation. Adequate fluid intake, sufficient fiber, balanced micronutrient intake, all of these support how the body processes what you eat. Eggs contribute to that system, but they rely on the system functioning well. Before you go, I want to know two things. First, how many whole eggs are you currently eating in a typical week? Just the number. The pattern across this audience will tell me what to deep dive next. Second, have you been eating egg whites only or whole eggs with the yolk? Just whites or whole? I want to see how widespread the yolk removal pattern is. Because per what we just covered, it is the single most common mistake that strips eggs of their vision and brain benefits. To recap, in case you came in late after 60, your body responds differently to food. Eggs are one of the most efficient sources of three things your body increasingly depends on. High biological value protein for muscle maintenance against anabolic resistance. Choline for memory and cognitive function. Lutein and zeaxanthin from the yolk for macular pigment density and age-related vision protection. The cholesterol concern has shifted. For most healthy adults, moderate egg consumption is not associated with increased heart disease risk, especially when the overall diet is balanced and minimally processed. The pattern matters more than the egg. 4 mistakes cancel the benefit. Pairing with processed meats and refined carbs, removing the yolk, overcooking at high heat, treating eggs as a small addition rather than a functional protein anchor. The functional range for most healthy adults after 60 is 2 to 4 whole eggs per meal. Paired with vegetables, prepared with moderate heat consistent across the week. Start tonight or with tomorrow's breakfast. 2 whole eggs soft-boiled or poached with sautéed greens and a piece of whole grain toast. Notice over the next 2 weeks how you feel. And if you know someone who has been quietly limiting their eggs for years because of cholesterol advice from a decade ago, send them this video. The science has shifted. The functional needs of their body have shifted. The advice has not caught up for most of them. I'm Dr. Corinne Holm. Subscribe for new videos every single day and take care of those eyes and the body and brain that support them.